Hey everyone, I'm Haleigh Dunning from the Childhood Lead Poisoning Prevention Program here at the Hamilton County Health Department. If you're like me, you've been spending more time at home this year and less time doing your normal activities, so we want to remind everyone that childhood lead poisoning hasn't taken a break and is still a problem in our community. The bottom line is that the only way to know if your child has lead poisoning is to have a simple blood test. This should be done if your child is between the ages of 6 months to 6 years old. According to the CDC, lead poisoning is the #1 environmental health risk for children here in the U.S. Children can become exposed to lead when they breathe in or swallow lead dust that has settled on food and other surfaces around the house, such as during a renovation project. When they put paint chips in their mouths, as a typical small child does, and when they play in lead-contaminated soil, especially in neighborhoods with industrial histories. Or they can even become exposed by a parent who works in an industrial environment by bringing it home on their clothing. If a home was built before 1978, the year lead was banned from consumer products, it could contain lead-based paint. It is important to remember that children may not show signs or symptoms of lead poisoning, but over time, lead poisoning can cause decreased growth, learning problems, impaired hearing, behavior problems such as hyperactivity, and nerve and/or brain damage. How much lead can be in the body before problems develop? The answer is any amount. There is no safe amount of lead in the body. Thankfully, lead poisoning is preventable. You can reduce your family's risk by fixing any chipped or peeling paint or asking your landlord about fixing these issues. Using a wet cloth or a mop when cleaning surfaces and floors to prevent the dust from becoming airborne. Cleaning toys frequently because, as we all know, they will put them in their mouths. Encouraging good hand washing habits, and removing or wiping down shoes to prevent spreading soil around the house. Did you know that children with healthy diets absorb less lead? Make sure your children eat nutritious, low-fat meals that are high in iron and calcium, such as spinach and dairy products. Keeping all of this in mind and getting back into routine doctor's appointments will help ensure the safety and health of your child. Remember, if you think they may have been exposed to lead, or you've recently moved or done home renovations, or your child has not been tested at their 1 and 2 year well check appointments, then call your doctor and ask for a lead screening. If you're repairing or renovating a home or work in an industry setting that exposes you to lead, you can find more safety information from the cdc.gov and epa.gov. For more information on lead poisoning, contact our department at 423-209-8080 or visit our website at health.hamiltontn.org. Our program is here to assist you if you need any help.